Plasmocytes, or plasma cells, are a type of white blood cell responsible for producing antibodies. Normally, they have a round or oval nucleus, abundant blue cytoplasm filled with rough endoplasmic reticulum, and a visible Golgi apparatus near the nucleus, indicating their role in protein synthesis. In plasmocyte cancers such as multiple myeloma, these cells become abnormal and multiply uncontrollably in the bone marrow. Morphologically, cancerous plasmocytes show variations. Some retain mature features, while others appear immature with irregular nuclear shapes, prominent nucleoli, and abnormal cytoplasm. These changes can indicate disease progression and prognosis. Immature forms, like plasmablasts, are linked to poor outcomes. This cancer leads to the accumulation of abnormal plasmocytes that can form tumors in bones and cause symptoms like bone pain, anemia, and immune deficiency. Diagnosing involves both cell morphology examination and tests such as flow cytometry.